Good morning, Alex and friends. I'm Grace. Today is Tuesday, October 22nd, 2024, and you're listening to Alex's News. Today in Riverside, temperatures will soar to a high of 88.1 degrees with a low of 62.9, so plan accordingly for a warm autumn day. Coming up on Alex's News, we'll explore the potential impact of a classified document leak on tensions in the Middle East. We'll also discuss how the Kaiser mental health strike could affect access to therapy services. Finally, we'll delve into the surprising connection between mammograms and heart health, revealing what these routine screenings might tell us about our cardiovascular well-being. Stay tuned for these stories and more on Alex's News. We begin with a concerning development in international affairs. Highly classified documents detailing Israel's potential retaliation plans against Iran have been leaked, causing alarm within the Biden administration. Joining us now with more details is our correspondent Ethan. Ethan, what can you tell us about this leak?
Thank you, Grace. This is indeed a serious situation. According to reporting from the Los Angeles Times, President Joe Biden has expressed deep concern over the unauthorized release of these top-secret documents. They were originally intended for officials in the Five Eyes Intelligence Alliance, which includes the United States, Great Britain, Canada, New Zealand, and Australia.
Can you elaborate on the content of these leaked documents, Ethan?
Certainly, Grace. The documents, which are attributed to the National Geospatial Intelligence Agency and the National Security Agency, contain analyses of satellite imagery and information about covert drone activities. They essentially outline Israel's potential plans for retaliating against Iran, following a recent ballistic missile attack on October 1st.
That's quite sensitive information. How did these documents become public?
Well, Grace, according to SIED intelligence group analysts, the documents were first posted on the Telegram messaging app just 2 days ago, on Friday, October 20th. They were initially shared on a channel called Middle East Spectator, which has a history of posting pro-Iran content. However, it's important to note that this channel denies any official ties to the Iranian government.
I see. How is the Biden administration responding to this leak?
The White House is taking this very seriously, Grace. As reported by WXII-12 News, the administration has launched a full investigation involving the Pentagon, Justice Department, and various intelligence agencies. They're trying to determine whether the documents were leaked intentionally or obtained through hacking.
Given the sensitive nature of these documents, what potential consequences could this leak have?
The implications could be far-reaching, Grace. Experts warn that this incident could significantly impact future intelligence sharing between Israel and the United States. It may also harm American interests in the Middle East, particularly in terms of protecting U.S. troops in the region. Additionally, it raises concerns about cybersecurity and the management of classified information, despite enhanced measures implemented since previous leaks.
Has there been any response from Iran regarding this leak?
Yes, there has been. According to Al Jazeera, Iranian Foreign Minister Abbas Araghchi has criticized President Biden's comments about the leak. Araghchi suggested that those with knowledge of Israel's plans should be held accountable. Iran has also vowed a decisive response to any potential Israeli attack.
This certainly seems like a complex and evolving situation. Is there anything else you can tell us about the U.S. government's efforts to prevent such leaks in the future?
Absolutely, Grace. The U.S. government has implemented several measures to enhance security, including improved tracking of access to classified documents, up-to-date non-disclosure agreements, and the establishment of a joint management office for insider threats and cyber capabilities. However, this recent leak suggests that there's still room for improvement in these security protocols.
Thank you, Ethan, for that comprehensive report on this critical international development. We'll be sure to keep our viewers updated as this story unfolds.
You're welcome, Grace. We'll continue to monitor the situation closely.
And that concludes our first story for today. Stay tuned for more news after the break. We turn now to a developing story in Southern California. More than 2,400 Kaiser Permanente mental health care workers have begun an open-ended strike. For more on this, we're joined by our healthcare correspondent, Chloe. Chloe, what can you tell us about this strike?
Grace, this is a significant development in the healthcare sector. As of yesterday, October 21, 2024, thousands of mental health workers across Southern California, from Los Angeles to San Diego, have walked off the job. This includes a wide range of professionals such as psychologists, social workers, psychiatric nurses, and addiction medicine counselors.
This sounds like a major disruption. What are the main issues driving this strike?
The striking workers, represented by the National Union of Healthcare Workers, or NUHW, have several key demands. They're seeking better retirement benefits, improved working conditions, more time between patient appointments for preparation and administrative tasks, wage increases, and pension benefits similar to those provided to their Northern California counterparts.
I see. Is this the first time Kaiser has faced such a strike?
No, it's not. In fact, this marks the second major strike by Kaiser mental health workers in just over 2 years. In 2022, there was a 10-week strike in Northern California that resulted in Kaiser committing to hire more therapists and provide specific work hours away from face-to-face patient care.
That's interesting. Are there any specific workload issues that the workers are concerned about?
Absolutely, Grace. According to reports from the union, some workers are seeing between 32 to 35 patients a week in one-hour sessions. This heavy workload is leading to burnout and high turnover rates. In fact, the union notes that a quarter of therapists hired between January 2021 and August 2024 have left their jobs due to poor working conditions.
That does sound challenging. How has Kaiser Permanente responded to these concerns?
Kaiser has put forward several offers. They're proposing wage increases of 18% over 4 years and say they've invested over $1 billion in expanding mental health capabilities. They also claim to have increased the number of licensed mental health clinicians in Southern California by 30% over the past 4 years.
But I take it the union doesn't feel this is enough?
That's correct. The union criticizes Kaiser for being dismissive of their concerns and not addressing core issues. Kaiser, on the other hand, describes the strike as entirely unnecessary and accuses the union of slow-walking negotiations.
How is this strike affecting patient care?
It's definitely having an impact, Grace. Kaiser has been notifying affected patients and offering alternative care from other professionals within their network. They state that members will continue to have access to individual therapy appointments during the strike, but it's unclear how this will be achieved with many regular mental health care workers on strike.
This strike seems to be part of a larger context. Can you elaborate on that?
You're right, Grace. This strike is happening against the backdrop of ongoing issues with mental health care delivery at Kaiser. Last year, according to reporting from the Los Angeles Times, Kaiser entered into a $200 million settlement with the state of California to address delays in behavioral health appointments. This included a $50 million fine and a commitment to invest $150 million over 5 years.
That's a significant amount. Has there been any progress since the 2022 strike in Northern California?
There has been some progress. As ABC News has uncovered, improvements since 2022 include increased staffing, reduced wait times, and better non-clinical time allocation for workers. However, challenges persist, including high staff turnover and ongoing concerns about workload and burnout.
Is there any end in sight for this current strike?
At this point, it's hard to say. Both sides express hope for a resolution, and additional negotiation sessions are scheduled. However, the union is prepared for a potentially extended strike, given the challenges in replacing 2,400 mental health professionals.
Thank you, Chloe, for that comprehensive update on the Kaiser Permanente mental health workers strike. We'll be sure to keep our viewers informed as this story develops.
You're welcome, Grace. We'll continue to monitor the situation closely.
Here are some other headlines. A shift in consumer behavior is driving popularity of lower-priced new cars in the U.S. auto industry. Sales of vehicles priced between $20,000 and $30,000 have seen the largest growth share in at least 4 years. Factors like high loan rates and economic uncertainty are influencing buyers across income levels to opt for more affordable options. China conducted live fire drills off its southern coast near Taiwan, following a large-scale military exercise last week. The drills, part of China's annual training routine, are being closely monitored by Taiwan's defense ministry. These activities have raised concerns about regional stability and prompted international responses, including U.S. and Canadian naval operations in the Taiwan Strait. New campus protest rules have sparked outrage among college faculty nationwide. Professors argue these regulations threaten academic freedom and free speech, leading to demonstrations and demands for explanations. The controversy highlights tensions between administrative policies and core values of higher education. The Federal Trade Commission has implemented a new rule to combat deceptive online reviews. Effective October 21, 2024, the rule prohibits fake reviews, buying or selling of reviews, and undisclosed insider reviews. Violations can result in civil penalties up to $51,744 per instance. In battleground Georgia, low voter turnout among poor communities could significantly impact the upcoming election. Many in low-income areas feel disenfranchised and overlooked by political campaigns. Efforts are underway to mobilize voters, but challenges persist, including recent legislative changes affecting voting accessibility. We're turning now to an interesting development in women's health. Mammograms, typically used for breast cancer screening, may also provide valuable information about cardiovascular health. Here to discuss this is our health reporter, Ethan. Ethan, can you tell us more about this new application of mammography?
Certainly, Grace. This is a fascinating development in women's health. Emerging evidence suggests that mammograms can offer insights into a woman's cardiovascular health, potentially impacting how we approach heart disease prevention in women.
That's intriguing, Ethan. Can you explain how a mammogram can provide information about heart health?
Of course. The key finding here is that mammograms can detect what's called breast arterial calcification, or BAC. This is essentially a buildup of calcium in the arteries of the breast. According to recent studies, the presence of BAC has been associated with an increased risk of cardiovascular disease.
How significant is this increased risk?
It's quite significant, Grace. One study found that women with BAC on their mammograms are 51% more likely to develop heart disease or have a stroke compared to those without BAC. Another study noted a 23% higher likelihood of developing any type of cardiovascular disease, including heart disease, stroke, heart failure, and diseases of the peripheral arteries.
That's a substantial increase. How does this relate to the broader picture of women's health?
Well, it's important to note that heart disease is the leading cause of death among women, affecting 1 in 3 women. That's more than the incidence of breast cancer. So this potential dual use of mammograms could be a game changer in women's health.
I see. Are there any specific groups of women who are more likely to have BAC?
Yes, BAC is more prevalent in postmenopausal women, particularly those aged 60 to 79 years. The prevalence increases with age, with more than half of women in the 75 to 79 age group showing evidence of BAC. It's also worth noting that while the association between BAC and cardiovascular risk is significant across various ethnic groups, it's more common among white and Hispanic/Latina women compared to Black or Asian women.
Interesting. So, are radiologists currently reporting on BAC when they read mammograms?
That's a great question, Grace. Currently, there are no standardized guidelines for reporting breast arterial calcifications on mammogram results. The American College of Radiology classifies reporting vascular calcifications on breast imaging as optional. As a result, only a small percentage of radiologists include BACs in mammography reports.
That seems like a missed opportunity. Is there any movement to change this?
Absolutely. There's a growing call for national reporting guidelines and a BAC grading system. Many experts in recent studies strongly recommend incorporating BAC findings into mammography reports to enhance cardiovascular risk assessments.
Are there any limitations to using mammograms for assessing cardiovascular risk?
Yes, there are a few limitations to consider. First, most of the current studies on BAC and cardiovascular risk have primarily involved non-Hispanic white women, which raises questions about the applicability of these findings to other ethnic and racial groups. Additionally, the lack of standardized reporting hampers its widespread use as a risk predictor, while While several studies have shown an association between BAC and cardiovascular risk, more large-scale, long-term studies are needed to confirm these findings and establish clear guidelines for reporting and using BAC in clinical practice.
So it sounds like there's still work to be done. In the meantime, should women be asking about BAC when they get their mammograms?
It's certainly worth discussing with your healthcare provider. While BAC detection doesn't replace traditional risk factors, it can complement them and provide a more comprehensive risk assessment. It's particularly valuable for women who might otherwise be classified as low risk based on traditional factors.
Thank you, Ethan, for this informative report on this exciting development in women's health.
You're welcome, Grace. It's an area that we'll definitely be keeping an eye on as more research emerges.
Indeed. Thank you again, Ethan, for bringing us up to speed on this important topic. That's all we have for now. Today's episode was made by Alexander King with Claude Sonnet 3.5, the Perplexity API Malay, and the Google Cloud Text-to-Speech API Malay. I hope you have a great day. I'll see you tomorrow, Alex.